For years, cardiologists from across the country have been yearning for life-saving intervention.
There's a project that we've been chasing for more than 10 years. We've gone through various places trying to get a cath lab.
3 of such are about to be built under the Ghana Medical Trust Fund to save the lives of Ghanaians with heart conditions.
I'm telling you, this is the legacy of His Excellency the President. At the end of the day, we can simply not go around, make promises and go to bed. He will not even allow it. He simply is always talking about the Medical Trust Fund, asking where we are, what we are up to, and what we intend to do going forward. So I think that we are on the ground. And this week we are cutting the sod for all the 3 projects we are doing for the cath labs. From here we are hitting Tamale, we'll come back to Accra to do Korle Bu.
The administrator of the Ghana Medical Trust Fund, Ajua Obo-Biada Opoku, and her team were at the Komfo Teaching Hospital to inspect the site earmarked for the construction of the hospital's cath lab. A move, the CEO says, will save lives of people in Ashanti and beyond.
And if you know the importance of this, basically for those with heart failures, those with, we call it myocardial infarction, the ordinary person will say when they have heart attack. And when somebody experiences heart attack, the chances of survival is determined by its time. And it's a matter of seconds and then minutes. So if you have such a facility, then it gives us, we have the skill, we have the manpower, but it's the equipment we lack. So once we have this machine, we'll be able to save so many people. And as I indicated earlier, previously we thought heart attack was something that happens in the elderly. But we've had 20-year-olds, 30-year-olds. So everybody is at risk.
The high premium the hospital places on this is the reason a big space has been created to contain the construction of this laboratory facility.
As the leading referring center for the 13 regions surrounding us, in fact, the cath lab is one facility that we've been craving for some years now, because we have about 7 cardiologists. We have cardiothoracic surgeons, we have neurosurgeons that can make use of this facility to improve on health. Previously, we were referring our patients to Accra, people who require this service. And most of the time they have to be airlifted. If you look at the situation of the doctor who passed on last year. So, in fact, we've been making this thing ready. And let me say that what the Ghana Medical Trust Fund has done is extremely remarkable.
Cardiology has gone beyond where medicine can solve everything. So there are some diseases we see, especially some things like a heart attack, where medicine cannot solve it. So we can make the diagnosis, we can give you some medication, but it can't open up the vessel which is closed. So the gold standard for making those diagnoses and then interventions is a cath lab.
The Ministry of Health will be supervising the construction.
This came to our attention, quite late, and within a matter of 3 weeks, we have all the plans, design development ready for construction to begin. So that shows you how critical this is to the ministry, and the minister has personally, gotten himself involved for us to, get here. So as far as the ministry is concerned, it has our full backing, and once we get to clear the site and all that, we are capable of achieving the 3 months.
ADB Ghana Medical Systems Group is the contractor.
The main critical part for the project is the structural work, which we are commencing right now, and it's a single-story building, so it's not a challenge.
According to the administrator of the Ghana Medical Trust Fund, the 3 cath labs should be ready and running by the end of the first quarter this year.
The engineers have promised us that they will do the demarcation by the close of the week, and then work will start. Basically, what we are trying to get them to do is to build, install in 3 months. By the end of March, we want this facility to be commissioned by His Excellency the President. Then we start rolling it out. I think that it will just definitely solve a lot of problems for our healthcare facility.
What the Ghana Medical Trust Fund has done is extremely remarkable, because it's God sent. We've been looking at all sorts of ways to get this facility, and I think it's one of the best news to begin the year with, to have the cath lab in place.